Now I would like to share on the panel management. So we know that a lot of time the clinic is actually engaged with the panel. By month end, you will need to generate a report or billing invoice to the panel, and meantime you would like to keep track on the payment. So in our system, it's very simple. Basically, when you actually register the patient, you will need to actually tie the patient with the panel. So this is example, some list of panel that actually engage in the clinic. So once you have actually done that, so you will need to create, when you seeing the patients, you create a new medical record. Our system will allow you to put in a panel note. So where there's a pop-up, you see that for these patients, a month limit to 50 ringgit per bill. So this panel note again to remind the doctor what are the things that cover and is there any limitation in terms of the billing. So coming into the medical record, as usual, doctor would, based on the history and the today complaints from the patients, to put in the diagnosis and next action and so on. And meantime, over here, the doctor can also actually quickly put in the bill. Let's say 25 ringgit for the consultation, any prescription, put in the prescription. If let's say that's all, you can actually just save and proceed with the billing. So in view of this patient is a panel patient. So and this bill basically is actually not exceeding the limit of the panel. So I do not actually proceed for any collection from the patient. But what I can do by end of the month, that I would like to actually generate a panel report for AMAS patients for me to bill to AMAS. So very simple, come to clinic report. And we have a report specifically for panel, invoice summary group by panel. Double click on it. Click on invoice summary group by panel and select the start date. Let's say it's actually from 1st of May till 15th of May. It's up to you to define which is the date. And you can search by the panel. So just click on load and you will actually get the report instantly. So this is your company address and name, panel, AMAS, and when you actually register, you can put in the full address of the panel as well. So this is the date of issuing the bill and who are the patient, what is the figure, that's it. So definitely the format of the panel report, right, customizable. If let's say that maybe some panel they would like to actually put in a remark on the diagnosis or maybe the company name and so on, yeah, we can actually customize it according to the requirement from the panel. So once we have issued the panel report or invoice to the panel, by the time that you receive the payment from the panel, what you can do is that you can knock off by mass payment very easily in our system. What you can do is you come to billing and you select the date of outstanding and also come to select AMAS search. So these are the three patients that having a not pay status for AMAS patient from 1st of May to 15th of May. So total 3 patients, 203. So when you receive the payment from the panel, so you can actually click on mass payment, and this is the breakdown of all these patients and total amount of 203. But imagine that some of the patient, you may not able to get the full payment. So what you can do is you can actually adjust the amount, let's say 130, but then the fact is like AMAS only willing to pay off 100. So you can actually click on 100 and put in the group payment ID as well as the remark. Say the group payment ID is a remark. Yeah, because this one, the panel didn't actually pay full. So you can just straight away payment, whether it's a cash from panel or could be from panel, or you can actually put into online transfer, check, or you just put in the payment method, make payment. So basically you have already updated all bill. Like for example, if you want to look at this one, you can see that for this patient already settled, paid by panel. Yeah, that's all about the panel pay management. Yeah, if let's say you would like to actually create a new panel, create a panel note, very simple. You can actually come to here, Doctor Assist configuration. Very quickly, I would like to show you where you as an admin or maybe your clinic manager will be able to access to the configuration and create by their own self. Go to the panel limit. Yes, you can actually set by panel and also set off the panel limit with the message, a pop-up. A panel note, you can also do that as well. Like for example, BSN. By when there's a panel note pop up, it could be actually happen, you want it to happen on create a medical record click, or on when you save the medical record, or when you prescribe any like create a bill. So you can actually select when and when the start time of the panel note and when is the end of the panel note. Yeah, let's say it's actually until 2010, and then the content limit to 100 per bill, any note. So you make it active. So you can actually having the same panel reminder, panel note at a few steps. So you will not actually overlook, because we understand that a lot of time you may actually forget to set up correctly. So eventually the nurse or the doctor will actually overlook and charge to the patient without collecting the payment from the patients. The patient might need to pay partially if let's say it's actually out of the coverage. So meantime, you can also easily to create a new panel in our system. Like for example, over here, we have some panel which already set up, but you can actually set up a new item. So you can actually put in the new billing type name, for example, company ABC. Put in the address and so on. So once you have saved, then now you have a new panel that you can actually started to charge to. So that's all about the panel billing. Thank you very much for your time.